We're hopping right back into where we left off with hyperlipidemia medications. We stopped with the statins and we're going with the next class. This one is Zetia, which is honestly a class of its own. It's the most common non-statin drug used out there so far in the community setting. And the way this one works is it prevents cholesterol from being absorbed in your intestines, so it works alongside the stomach and pushes it on out your system. So this drug is often used alongside exercise and dietary recommendations, and can be used off-label for other disease states. It's overall a good standalone drug, only comes one way, and works well alongside lifestyle modifications. Side effects do include diarrhea and joint pain, but like your statins, if you give it enough time, that pain can and will go away. And otherwise, it's well tolerated. Interaction-wise, you may want to separate it from antacids like Tums, herbal medications like red yeast rice, and immunosuppressants again like cyclosporin. You do want to separate these by 1 to 2 hours just to make sure the medication has time to do what it does. If you're on a bile acid sequestrant, which is a drug class we're going to talk about later and is associated with cholesterol, you either don't want to take these medications at all, you want to separate them by a minimum of 2 hours before or 4 hours after taking this medication. And that is very, very important. We'll talk about why later. The next class is your PCSK9 inhibitors. You don't really need to know what that stands for. Just know it's a liver protein. It is like a protein, blah, 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 blah. PCSK9 is all you need to know. Focus on that. So these drugs come into play when your cholesterol, like your LDL, your bad cholesterol, is still high and you've already tried other drugs like statins. Then you'll start seeing more medications like these. PCSK9 inhibitors regulate how many LDL, which is your bad cholesterol receptors you have, and this will affect how high your cholesterol can go, because the less receptors you have, the less cholesterol your body can absorb. Does that kind of make sense? So these are not used often because they are extremely expensive, and there's only 2 approved drugs by the FDA currently, Praluent and Repatha. I'm actively ignoring the generics of these drugs because y'all can't say them, I can't say them. We're on the same team. Why would you put me through this? Just know that these bad boys are expensive, and I mean in the hundreds of thousands of dollars. And that even the guidelines state that in order for this class to be cost effective by normal standards, the cost would have to be drastically reduced by 70 to 85% in the US. This therapy isn't injectable and is typically used in a hospital setting, or you would go to your doctor's office to get an injection every 3 months or so. Despite the price, these are surprisingly effective. Or on the flip side, these better be effective because they're so expensive, and they do decrease your LDLs or your bad cholesterol by up to 70%, which cuts the risk of heart attacks by almost a third, which is pretty good. Many side effects include fatigue, muscle pain, and swelling near the injection site. The next class we have are your BASs, the bile acid sequestrants. What are bile acid sequestrants? I am so glad you asked. These are the drugs that lower your bad cholesterol, your LDLs, by blocking the bile acid in your stomach from being absorbed into your blood. Some of the names that would be included in this are your Colestipol, Welchol or Welchol, depending on who you're talking to and what region you're in, and cholestyramine, the nasty little packets that people, I just had trauma. Wow, I had a patient fling some packets back at me because they paid a price, thought it was going to be something, realized it looked like a little, like them little vitamin packets, and then just kind of ninja started at me, but that's neither here nor there. I'm sorry, PTS comes sometimes, so sorry. Getting back on topic. These can be used alongside the statins, but unlike the statins, you should not stop taking these when you feel like it, and should absolutely talk to your doctor if you want to stop taking it. Here's why. These are not well absorbed in the body because they're not meant to be. They are literally blocking your bile acid and pushing it out of your body. So the main complaint would be what? GI problems, stomach pains, things along the line. So we're talking gas, bloating, diarrhea, nausea, heartburn, things of the sort, things along that nature. Side effects that you would need to call your doctor about would include like vomiting, sudden weight loss, and we mean like more than 5 pounds in a week, bloody stool, bleeding gums, or severe constipation. And that's kind of why you don't want to stop these, because stopping them can make these side effects go left very quickly. BASs that come in powder form must be mixed with water or other fluids that can be taken quickly. However, soups and blended fruits are also included in these approved liquids. And I don't know how quickly you can suck up soup, but have at it. There is not a time that's actually like listed in the guidelines, so I don't know. Maybe we'll look into that. I do know that these powdered solutions are very thick, so you are going to need a lot of fluid in order to dissolve it properly. And if you don't like drinking a lot of fluid in one setting, this drug class is not really going to be great for you, like quality of life wise. If you have the pill form, you still need to take this with plenty of water. We're talking a full glass of water, like a whole 8 ounces. And no, you cannot chew or crush the pill. So if you're one of my gerbil-like patients who like to nibble your way through life, this is not for you. Matter of fact, if you are one of my gerbil patients, stop chewing the meds. Stop it immediately. You cannot chew and nibble on your medication because you are afraid of swallowing and choking and then complain later about side effects. You are literally eating, licking, nibbling through the protective coating of the medication, which is exposing your body to this medication long before you really need it, which is making the side effects happen. So stop. Choking is not a laughing matter, and you probably need some help in how to take meds properly. There are some therapists out there to help with swallowing. I feel a pun rising in my spirit, so I'm going to get back on topic, but stop chewing your meds. Stop it. Most of you are adults. If you're not an adult, ask your parents. If you're an adult, stop it. So the next one is niacin. Niacin is a B vitamin that limits how much blood fat your liver produces. It's technically available over the counter, but the OTC version, which is over the counter, is not equal to the pharmacy version. But at the same time, it's really hard to get that retail version. And you may just need to talk to your provider about what that dose needs to be and how to properly attain it. This also deals with the fact that no two OTC items are equal because they're not covered by the FDA, which means that one company can make it one way and another company can make it another way, and nobody's really checking them on how it's being made and how much of it's actually going into it. So let's say this company is making niacin at 50 milligrams. This company is making it at 500. There could be a full 50 in this one, and this one could be half and half. And because the FDA lets it be over the counter, they're looking, but they're not checking it. Think of TSA like thoroughly going through your bag versus just letting it go through that little belt. Kind of like that. The retail version also tends to be a delayed release because niacin also acts very quickly. Delayed release allows your body to absorb it a little slower, and taking it in higher doses can cause side effects such as flushing or itching, which can lead to heart issues. So doubling up the OTC version will not equal the retail version as well. Also try to keep that in mind. Also, too much niacin can raise your sugar levels, so diabetic patients should also be aware of that as well. Last but not least, you have your fibrates and omega-3 fatty acids. These are the big oily pills you might have seen your grandmother taking when she pulls out her little vitamin organizer, which I have as well, but that's neither here nor there. I'll talk about that in another video. But the fibrates and omega-3 fatty acids are two classes that primarily lower your triglycerides. Now, as cholesterol is broken into the different categories, triglycerides are almost kind of a standalone. You have these medications that focus a lot on your HDLs, which is your good cholesterol, and your LDLs, which is your bad cholesterol. And a lot of these will kind of touch your triglycerides, but at the same time, they're just kind of there. So you do have a couple of medications that will directly affect your triglycerides, but the downside is they only affect your triglycerides. And so a lot of times your doctor may kind of play a weird game of tug of war trying to find the balance or the sweet spot of where your cholesterol needs to be. So this is not necessarily a bad class, they're just a little more focused. It definitely doesn't make them less important, because if your triglycerides are high, you're in trouble. So, like a lot of these other classes, you will do this alongside dietary changes. Side effects for your omega-3s would be cramping, muscle pain, lower kidney, and liver function, which is monitored by your labs, which again is done every 3 months or so. Taking too much omega-3s can put you at an increased risk for bleeding, so please be mindful of that. A way you can monitor is like if you're running into anything and you're noticing like a lot of bruising that's just not going away, your blood may be too thin. And especially if you're not on a blood thinner like aspirin or warfarin, then this may be a sign that your omega-3 dose may be too high, or maybe you're retaining too much in your body. So definitely bring that up with your provider, and your provider will also recommend hydrating with as much water as you can tolerate. The most common fibrate you'll see is fenofibrate, and the most common omega-3 acid kind of comes as itself, but the brand is known as Lavazza. You may see that sometimes, but last time I checked, Lavazza has not been covered by most insurances. And yeah, you'll just see omega-3 kind of come by itself. So that's it. That is all of the main classes that you'll see in a community setting when it comes to cholesterol. You do have many different ways to lower them alongside lifestyle modifications. On this channel, we are going to push lifestyle modifications because as a pharmacist, it is important to take your meds, but it is also important to change your life, because we don't necessarily want you to be on the medications your entire life, because that's not good quality of life. We want you to be able to go out there and enjoy the things, do the things, see the things, and you can't do that if you're stuck at home with your little vitamin rack. So take the meds, do your part, go enjoy life. As usual, if you have any questions, comments, concerns, you can post them in the comments below. We have our Google form on the channel. And until I see y'all next time, stay safe.